Good afternoon and hello again. I've had the pleasure of getting to know Rhonda a little bit. Actually, the first thing I had to ask was how should she be addressed? General, doctor, but she said for the purpose of this interview I can call her Rhonda. So got that over with. Fascinating life history, which has led to some real insights into health, wellness, and data. But just to give you a little of the background, as many of you may know, Ron was a brigadier general who was in the Army during the first Gulf War, was in a Black Hawk, she was a surgery, what was the exact title?
I was a flight surgeon.
Flight surgeon, exactly. Shot down and was a POW. And her experience during that episode, which she says left her unscarred because of some mental techniques that she has both studied and perfected, led to her starting a program called the Comprehensive Soldier Fitness Initiative, which was really not just about the physical fitness and preparation and sort of exercises for the soldiers, but also the psychological preparedness for basically experiencing stressful situations without having become traumatic. And this experience was an incredible success. It created in 2008, and it was based on the University of Penn's
the Penn Resilience Program
research on the psychological health of students. But now 12,000 people in the Army have participated in this. Sorry, 2.3 million have taken the assessment, and 12,000 trainers are doing what's called master resilience training. In February, she left the military and is now working with a company called TechWorks, but really thinking about how to apply this to the rest of us and both companies, schools, and beyond. So with that background, let me just start with the whole concept of how you came to the notion that stressful situations, that injuries, etc., didn't have to be traumas. And what do you mean by trauma in this instance?
Well, from my standpoint, it has to do with the post-traumatic stress, which people have, the literature has exploded about that. I had a number of what I suppose would have been considered potentially traumatic experiences, and I never felt any of those things I was supposed to have gotten. So personally, I wasn't a psychologist. It just seemed like that there was an incongruity there. So because people kept asking since '91, what's wrong with you? And I said, well, nothing that I can find. So luckily, there is a whole science about positive psychology and post-traumatic growth versus post-traumatic stress, and I was very fortunate that the Chief of Staff of the Army, at the same time that there was sort of this explosion of problems because whether the stress of the wars or whatever, I got to the position where I could help him implement a strategy to do some psychological fitness training prior to being exposed to a potentially adverse situation. And so we used it just as the model as for physical training. And for those of you who've ever run a race, and there's one really famous race guy here, I would say that everyone would agree that the time to train for the race is not after you have run it. And yet we had all of these programs for people after they came back from a deployment, and nothing for before there was an issue. So I said, we need to prepare people before they face some challenge, and it doesn't really matter what the challenge is, whether it's combat or it's a divorce or it's cancer or it's a car wreck or whatever it is. The techniques for dealing with challenges are pretty similar.
You use the phrase post-traumatic growth, which I think is profound, and the notion that an adverse event doesn't have to be traumatic. Let's go back into your bio and talk a little bit about what you learned from this. You're shot down. You are shot. You have broken bones. You are abused. A week later, you're rescued. I guess you're freed. Can you talk a little bit about just what did you learn from that one experience?
Well, I learned how important, for example, I came out a better patient, a better doctor, a better parent, I think, a better leader. But I realized that a lot of people think that something bad happens to you, and and that the only possible outcome was something negative. And yes, I did get shot, and I broke both my arms and my leg, and so it never even crossed my mind that I was going to be permanently damaged by that. Now, it is true I can't do as many push-ups as I once could. I'm guessing that at 57, most people can't do as many push-ups as they once could. So I don't know that I could have if I hadn't been shot in the shoulder.
I remember that when I was a kid, that the notion of military fitness being a kind of a model, I think there was a Canadian or Australian, guy who was all about jumping jacks and things like that. And so we get that, but we don't think of the military as being a place for psychological fitness. You started as a urologist, and then you pivoted to the psychological component. Can you describe a little bit of the psychology of a new recruit? So, take an average recruit. I know you've talked to hundreds, if not thousands, if not more, of them. What do you say? How do you teach a 17, 18, I guess where they'd be older, the 18, 19-year-old, to prepare themselves to turn an injury into a growth experience?
Well, we don't start there. We start with how to communicate better and how to make better decisions and how to look at what happens realistically instead of catastrophically. Mm-hmm. And it can be something as simple as one thing every recruit has to do successfully before they can graduate is go through the gas chamber. Mm. And in every class, there's some number of people who just are paralyzed into inactivity. And it used to be, before we had this kind of training, that the drill sergeant would basically just scream at the guy until he either peed in his pants and went home, or went into the thing. We have learned a better technique that gets more people through, and which is, so tell us why you are afraid to go in. And they will list, I think I'm going to die, my mask won't go on, it'll be locked, And so then we say, okay, well, first of all, let's look at the evidence. There's no lock on the door, you can't get locked in. You have used the last 12 times you had to put your gas mask on, you did it in the right number of seconds. And lastly, the gas we're using is not, it's unpleasant, it'll make your eyes sting, but it won't kill you. And so applying evidence to unreasoning fears is much more effective than just screaming at somebody.
Can we drill down a little bit more on that example? So there's two people you need to teach here. There's the recruit, and then there's the drill sergeant, for lack of it. So I've seen the movies, and then the drill sergeants, the ones in the movies, are basically going to shout at you. Is there a situation where A, you've taught them not to shout, and B, that this person can ask for this special, the recruit can ask for the special treatment in a way that isn't personally embarrassing and humiliating? No,
but what we do have now is essentially every drill sergeant goes through the Master Resilience Training Program after graduating from drill sergeant school, because everybody recognizes that the old thing you saw in the movies was really not very effective.
And so they're pulled aside in some private place where they can have a...
No, often people are perfectly willing to have this conversation in front of their platoon. They're obviously unwilling to go through while there. You're at the top of the 40-foot tower and you're afraid to let go and come down.
And there's no shouting?
Well, there's no screaming. You might have to shout so they can hear you.
I see.
There's no berating, I think, is perhaps a better way.
Okay, a kinder, gentler.
It is a little kinder and gentler, but it's more effective.
Yeah.
And that, being effective is the key here.
So let's now pivot. You left in February, and you're now thinking about applying this in other settings. When you think about the most analogous civilian setting for the kind of practices and techniques that you use, what comes immediately to mind? Where do you think you'll be applying it first? Well,
I certainly think that the best place to apply it would be in schools. It was a program that was built for schools. We adapted it for the military.
By schools, you mean universities?
Universities, high schools, and middle schools. Mm-hmm. That's where all the data was derived that shows these things are effective. So that would be the best place to go to do it, as opposed to do it, but do it deliberately and ubiquitously. Don't do it as a pet pig project, one school system per state. Because those are the kids. I mean, the only reason we're doing it in the Army is those are skills that kids didn't learn before they came.
Yeah.
And not that every kid, some kids actually have them. They have lots of self-confidence. They have lots of self-efficacy. They have lots of empathy. They have self-regulation. But if they can't talk about it, then they can't help spread it to their peers or their subordinates either. You have to be, if you want to teach it, you have to be able to articulate it.
So we have tons of training in schools about drugs and sex and other things.
Right.
But I would say the school is full of trauma. You would say it's full of adverse events, but everything from bullying to test stress, et cetera. How, when should this conversation happen? Who should be giving, should it a parent thing, a teacher?
Parenting would be a good place, and one of the beauties, one of the great things is that we, when we teach this to soldiers, most soldiers are parents, and the first place they actually use this is at home. They try it out on their families before they're, willing to try it at work. And they have met with such great success that most of them will then move on and say, wow, I just had the best conversation with my kid I've ever had. So this might actually work.
Okay, so parenting, and by the way, I think you mentioned that there's a book that parents or anybody could use. It was called The Resilience Factor.
The Resilience Factor. Karen Rivich, who's the primary trainer from the Penn program, she's the author, and it's excellent, and I would recommend every parent read it.
Now let's turn to the teachers and the curriculum and the more formal institutions. How does your equivalent Army program get implemented, for example, high school?
Well, I think it would be guidance counselors and whoever is a homeroom teacher probably would be a good place to start. Mm-hmm. Coaches would be a good place to start. I mean, I think we all recognize that success is probably 50% mental, not just muscles and cardiovascular systems.
With the theme of the conference in mind, one of the things we were talking about, and it's really quite striking, is measurement and data. The military, for all sorts of reasons, has incredible amounts of data, both because they have a kind of a fixed cohort, they drug testing and physical testing, all this kind of stuff, and also because I guess they have to do it, right? Everyone there has to comply. And yet they don't do much with the data. When you think about measurement, analytics, diagnostics, and then action upon that, what do you think are the opportunities both within the military and then when you take those lessons out here in civilian space?
Well, I think it's really important to measure because what I have found is that we have historically measured the success of something by compliance with it, not by whether it had the desired effect. And so, as you mentioned about schools, you have anti-drug, anti-sex, anti-bully, you have anti-indiscipline of every sort, and I'm guessing that the school measures their success by whether every student got it, not whether every student stopped doing it. The Army and the military does the same kind of thing. We measure success historically by what percentage of the population was exposed to the training, not whether it had the desired effect. So we were committed to not doing that again. So we deployed an assessment, the global assessment tool, a self-report survey of psychological health in the emotional, social, family, spiritual, and so then measured the effect of having master resilience trainers in units by looking at the change in the GAP scores in subsequent years. And so we showed not only what percentage of people participated, but that there was a statistically significant improvement in some important things, positive coping, adaptive, catastrophic thinking was decreased, that sort of thing. The reason I think we need to go back to schools is because the effects were much larger, and there were more of them in people 25 and under than in the older population.
So now I imagine that I'm the CEO of GE and you're my head of HR. What should we do differently? What should we do to implement your practices?
Well, I think I would first assess where you are as an organization. If there, and whether you use Diener's flourishing scale or whether you use some other scale, some easily measured thing that does something that measures psychological assets. I think it's really important for people not to be looking for pathology, so not to be measuring symptoms, but looking for psychological assets. And then most people will probably do it if they feel safe. So like my boss isn't going to see the results.
And there'll be a psychological test as part of my just annually or once? Or?
Yeah, we do it annually. And everybody does it.
And it's an online thing you fill out?
It's an online thing you fill out.
Okay.
And it has, we have about 87 to 90% people take it seriously, and actually, the various ways people look at results to show that they didn't just say C on every answer, and they had questions that answers that made sense.
Now, in the military, I presume that the results of those tests are then evaluated by superiors of various sorts.
Well, there's absolutely, it's anonymous. Only the person who took the survey sees his personal results. There is, however, we do dump that, assign it a surrogate identifier, and then combine it with the other things. So, for example, PT test scores and promotions and the various Uniform Code of Military Justice things, drug use. So we can tell, because we want to be able to show that A, psychologically healthy people have fewer of those bad things, and we show that people who are psychologically doing well are more likely to be promoted and go to more college and that sort of thing. And so people, those facts are widely available now, and so everybody can see that if I were more psychologically fit, I would be more likely to do well. So there's some incentive to doing well. Not to mention the fact that you'll consume less health care.
So the notion is that the consumer, there's two consumers, they kind of statistically anonymize a consumer on the organization level, and the individual themselves see their own scores, and if the score is not what they want it to be, there's something they can do about it.
Yes, and you take the assessment and you get an individualized plan of what we recommend. It's an algorithmically derived plan of what we think you should do, which courses you should take, type of things to improve.
And so, again,
you're welcome to do it or not do it. But
again, I'm GE, and so along with this, I need to train in the same way you had to train the drill sergeants.
Yeah.
We have to train our managers, and the same way that you had programs available to people if they wanted them, or if their test results suggested they could use them, the corporation would have to provide that as well.
Correct.
Is this what you're doing with TechWorks?
Pretty much.
And it's a software company?
It's a software, yes, but more. It does a lot of different things.
Okay. It's still early. Presumably the results, the products have not yet been released, but that's kind of where you're going. I do think of civilian life being full of traumas of various sorts. Adverse events, I'll try to stick to the terminology, but a lot of us receive them as traumas because we haven't learned to avoid the scarring, if you will. In your performance review at work, a poor performance review or something like that, is it simply a matter of sitting down, of understanding that there's a better way to internalize this, sitting down with someone and understanding how to sort of extract the positive lessons? Is it 2, 3, 4, 5 meetings and you're there, or does it take a lifetime of work?
Well, I think understanding what happens, so let's say you're sitting down talking to your boss and you get not the evaluation you were hoping for. You can internalize that, and you can go back and say, I'm stupid, I'm not cut out for this. That doesn't lead to any, if you believe it's a global problem and it's me, that doesn't lead to you doing anything purposeful to change it, because it's hopeless. If you say, I could have shown up on work on time more frequently, if that was one of the complaints about you, if it says that, I could have, in fact, not been using the work computer when it wasn't lunchtime. I mean, so if there were specific things that your boss said about you that you could, if you focus on the individual things that you could have done differently, then you can change and you can improve. And so one of the big things we teach is that things are local, not global, and a particular time frame as opposed to forever. If you get dumped by your boyfriend, that doesn't mean you're unlovable or ugly. That means that you and that guy aren't going to get along forever. And if there's 7 billion people, there's 3.5 billion more guys. So you could probably find another one.
You are constitutionally inclined this way. I think you told me that you've never really had a trauma in your life, that you've from the youngest age been able to turn these, whatever didn't kill you made you stronger, et cetera. So I'm going to argue that it was easier for you than for some, because you're just a kind of an optimistic, glass half full sort of person. Take someone middle-aged who feels scarred, who feels traumatized by life. Can you turn them around?
I believe that you can. I believe that's what cognitive behavioral therapy does. We use it preventively so that people can practice those same techniques on small challenges, so that when you get faced with a really big one, it's easier to do. But that's true about any kind of thing you want to learn. I mean, we don't wait until there's a crisis. We don't wait until someone is shooting at you in the Army before we teach you to shoot back. We kind of send you to the range first, and we give you lessons, then we let you stand up, and then we have a live fire exercise where there's somebody sort of shooting over your head, and you're shooting back. So we don't wait till there's a crisis and then all of a sudden say we're going to have, just-in-time learning. So that works for some things, but it doesn't work really well for things that you need to be using every day. So I think we need to apply that same kind of thinking. I mean, I didn't learn to stop a plug, to stop the bleeding in the aorta the first time somebody made a hole in one. I mean, I kind of learned that technique before I got there.
Can you give me an example of a little thing that demonstrates what you're talking about, something that somebody could learn in midlife? An example of an adverse effect, an adverse event rather, that you could focus on as a kind of a baby step towards this process.
Sure. An adverse event as an adult would be you applied for a promotion and didn't get it. Mm-hmm. And so it's not like you're going to starve to death, or it just means that now you're not going to be able to buy whatever it was you were planning to do with the excess money you made. So we would work kind of through that, and what can you do differently to increase the likelihood it will happen next time.
So lesson number one is don't catastrophize. Right. And number two, turn it into an action plan. So
if you feel guilty, if you feel embarrassed, if you feel something, if you have those negative emotions, you're sad, then we like to tell people that that should lead to purposeful action to change it.
One last question on the data front. If the world adopts this technique and we start giving people these exams, or at least giving them the opportunity to take these exams, and B, taking the data and learning from it, anonymized, et cetera, what do you think we'll do differently as a society? Just in terms of our healthcare policy, our internal corporate culture, our HR policies, you name it.
Well, I think we're going to have to do what we did in the military, which is attack it at all levels. In my case, that was the 4-star level, the 3-star level, the 2-star level, the sergeant level. But in our society, it's going to have to be the education, the compensation schemes. When we compensate people monetarily for continuing to have symptoms, that doesn't exactly incentivize you to get better. So we have different systems. I heard it several times in the last day about we've attacked this from a data standpoint, but we haven't attacked it from a governmental policy standpoint. And I think that if we don't do that, it's going to be very difficult to implement this across our society.
I'm going to take one question from Twitter, if I think I have time. Are there any gender differences in resilience?
We did not find any using global assessment, which we had intended to be gender neutral. We really didn't find any differences. Now, I couldn't tell you whether that means we were really successful at making it, or that women in the military are more like men. But we didn't find any differences.
And there was one other good question I wanted to squeeze in here. We talked about teaching, and we talked about books you could read. Do you find is there a preferred method? Do you think it should be taught, or can it be learned simply by studying these methods online or in books?
Well, what I can say is that there hasn't been any significant randomized controlled trials of learning it by a book or online that shows it was effective. That doesn't mean it isn't.
The Penn studies were all taught.
Were all taught. Mm. And I think the communication and relationship building is one of the things that's important. But whether or not it can be done using gaming, I mean, it may well be. There isn't any evidence that it is yet.
Possibly an opportunity for your new company.
An opportunity to excel for someone.
And possibly something your new company will
and who knows?
Have something to do with?
Who knows?
All right. No, please thank you, and join me in thanking Rhonda.
Thanks.
Thank you.